Welcome to another episode of Two Docs Talk. Today we have a very special guest, Dr. Tom Hackenberg. Tom is an infectious diseases specialist here in Colorado Springs, Colorado. Tom is here to talk about how to protect yourself from the coming cold and flu season. Tom is a wealth of information. I always learn something new every time I speak with him. As always, if you like the show, please hit the like button, subscribe, leave a comment. It helps others find the show in the search algorithms. We also have some exciting announcements. We'll be starting a Patreon page in the coming weeks, so you'll be able to support the show, get access to some special perks. Without further ado, we bring you our good friend and colleague, Dr. Tom Hackenberg. Tom, welcome to the show. We're so glad to have you. And just wanted to start out by asking, why do you think there's this seasonality for colds and flus? And how can we best protect ourselves to try to prevent these infections?
Well, a good question. I don't know that I'm completely prepared to answer this in a real academic fashion, but I think there's many factors. One is just how much immunity do we have from prior seasons, and when does that wane? Over a year or certain seasons. But also, it's very common this time of year in the temperate zones where we are, of children going back to school and being exposed to more viruses and sharing those viruses. And I think coming together indoors, we're in closer contact, so it's easier to spread a lot of these viruses, such as influenza, RSV, coronavirus. Some go throughout the whole year, though. Other parainfluenza, adenovirus, other respiratory viruses. As far as protecting ourselves, number one, I think we have to keep our own bodies in the best shape possible. And for me, I think people getting as much sleep as they can when they can, usually at night. I think that's good to be awake when it's light and sleep when it's dark, and get plenty of sleep, keep our bodies healthy. And I think they function the best when we have some muscle mass. We've done some movement throughout the day. For me, I think it's most valuable to be outside and do a lot of that movement and in touch with nature, and then just good, well-rounded nutrition and fluids. But then, during episodes where we had the bad outbreak of COVID, where you get a more deadly variant of a virus, minimizing exposure. So that is, staying away from crowds, keeping our hands clean. A lot of the viruses are probably spread not just in the air, but touching your face after you touch something that was contaminated. So, in the case of wearing a mask, during the outbreak and early on, I think it was very important, especially when we don't know what's going on and how serious it's going to be. I think minimizing all exposure is very important. However, I think the viruses have a lot of value to us. And, if we're in good health, and the natural exposure to viruses helps our immune system. Any exposure we have bolsters our immunity, not just to that specific virus, but probably to some other viruses, and decreases our chances of more serious disease from those. The number one way we do that actually is we use vaccination. And people always worry, oh, it's too many vaccines, too many exposures. Well, it's really nothing in compared to what we're naturally exposed to anyway. So it's far fewer, they call it antigens or components of a virus, that we're exposed to through the vaccine than you would be naturally. So our immune systems can definitely handle, the vaccines that are recommended. And so I think vaccines are a big component of that.
What are some of the risk factors that you see, like in common, individual that we see as a patient or as an individual that increase the risk of getting, an infection and get complicated with infection?
As far as being exposed to those people that are out in crowds and close to where there's an outbreak, they'll be exposed more. But those that are more likely to have serious disease already have some sort of immune compromise often. And, the most common are probably if you're on chemotherapy for a malignancy, or you're on steroids for an autoimmune disease. Your immune system might not respond as it would normally because we're trying to modify those people's immune system. So they're much more likely to get sick. But if you already have chronic lung disease, you've been a smoker, or just naturally have chronic lung disease, those that are just getting over another illness, those who've had congestive heart failure or kidney disease, all of those other illnesses, I think, put us at higher risk. So as we get older, there's some people are old when they're 35 because of all their other illnesses. Their immune systems don't work well, but our immune systems also wane as we get older. So, especially very old people who aren't in very good health might have even greater risk for severe illness.
what about diabetes and hypertension? Some of the common disease that you see so many of our patients unfortunately suffering from.
Yeah, you're right. I think those, I think they do mention hypertension. I'm not sure of the mechanism, but I think, I guess I imagine that it does affect your lungs and your heart as well, and puts you at risk. And diabetes would definitely affect your immune system. One of the things I think that was most shocking for me, I've been doing almost only infectious disease now for a little over 30 years. And after the pandemic, or in about the third year of the pandemic, let's say, after people had been so isolated, those people were also at greater risk for the common respiratory viruses and the natural consequences of those viruses. I saw more people die anecdotally, and I think there's probably some information about that. And I think the mechanism is that we were so isolated, which was good, for the severe COVID, but we didn't get the natural exposure to all these other viruses. So here we had otherwise healthy people, people in their 30s, 40s, 50s, 60s that were in the hospital with a terrible influenza or RSV or other coronaviruses, or the bacterial infections sometimes we get after those, like strep pyogenes. We saw people dying much more frequently from strep pyogenes, pneumococcus, and all these others, more than I've ever seen. And I think it's just because we were so isolated, we didn't get the natural immunity from our interaction with others and the viruses we share. And I always bring this up, and I probably should read about it again. So, don't hold me as the final word on this, but I recall reports on people who did research in Antarctica. During Antarctica's winter, very few or no people went in and out of that community. So it was a very restricted number of people there, and they shared their viruses at the beginning of their stay. But after several months, their immune systems also started to wane because they didn't get the natural boosting from the viruses that were in around in the environment. So when they left Antarctica, they would get much more sick. And I think they have done that. They've even done immunologic studies, I think, to show that that's the case. And I think something very similar happened during this pandemic or after it. Yeah.
I'm really interested to hear about this the RSV. That's become a household term over the last couple of years. Previously, it was we knew RSV in our pediatric rotations. Babies, children would get it. Usually pretty mild, can be serious in newborns. But now we're seeing this in adults, and not just a few. It's a lot of people getting this. I'm curious if you have any thoughts about why we're seeing that, and about the vaccine, how we can protect ourselves.
Yeah, that's a good question. I think the same issue might have explained it why it came to the media so much. Anyway, it's always been around. We've seen, RSV, generally it's respiratory syncytial virus, and generally 50% of all kids in their first year of life will get RSV, and the other 50% get it their second year. So within 2 years, all children have been exposed to RSV. Well, and we knew that it would still cause colds in adults, and actually in immune compromised patients, bone marrow transplant patients, for example, they could get disastrous disease from RSV. So not just the children, but those profoundly immune compromised could. Well, now, like we talked about, during the pandemic, when we were so isolated, we weren't interacting with others, that pool of children in their first 2 years of life may not have gotten RSV in those first 2 years of life. And so we don't have that natural spread and protection from the virus, such that once we are then exposed, we would have more serious illness. So I think that's one of the reasons it might have come up in the media. I actually don't know the number, so don't hold me to it as far as how true that is, but I think it's true that it's because we had much less exposure during those few years to RSV that it became more obvious and severe as we were older. We didn't get the natural boosting.
I'm always so fascinated about all those the secondary and tertiary effects of we do something to try to protect ourselves, and then there's another thing that happens. This is fascinating.
Yeah, me too. I think it is. We're trying to help, but there's always some ripple effects because it's so complex and there's so many interactions. One I know now with the vaccine, they do have an RSV vaccine for pregnant mothers is a big one. So I think the mother's antibody from RSV is spread. Any of the antibodies are actually only transmitted to the baby in the uterus after about 32 weeks gestation. So if a woman is 32 weeks gestation or later, so she has about 2 months before she delivers, and it's in the winter, well, I don't know exactly, I forget, I think it's probably sometime in July through December, they would probably immunize those moms if they're 32 weeks or later, such that they get antibodies spread to the baby, and then the baby's protected. If the baby didn't get antibody and got RSV, they could be very sick, and sometimes they use immune globulin. But so RSV in pregnancy was pushed during that time, and it seemed to make sense, especially at pandemic time. It's also recommended, I think, for much older adults, like over 75, assuming their immune systems are waning, or those that are at high risk, like we talked about, diabetes and congestive heart failure or immune compromise always, and they could also consider the vaccine as they're a little bit older.
What do you think this fall? What kind of vaccine should we be getting and prepare for this season?
Yep, good. Yeah, that's a real important thing, and I think about that all the time. Sometimes they talk about waiting, till there's a first outbreak or first case of these viruses in your community before, but it's kind of hard to predict. And so the main ones are influenza, COVID vaccine, and consider the RSV vaccine as far as the regular seasonal type ones. That RSV may not be necessarily seasonal, but so I just called today. I'm getting my vaccines this Friday, which is slightly early. Well, no, maybe not. I usually try to get it sometime in September, October. Some people do it October, November, but I think it's pretty good. Plus, I'm going on some travels, so on international airports, I kind of like to expose myself to things to help my immune system, but I don't want to get sick on the trip. So I decided to go ahead and get vaccinated this Friday, and I'm going to get the influenza because that's the most current one. And the COVID one, the newest one that was just approved in early or late August, is out in the community. Anyway, we can get it. I called the grocery store I go to get it, and I decided I'm not that old yet, and I don't have a real high risk factor, but I'm going to see if I can get approved to get the RSV vaccine. Normally I wouldn't do it. Any intervention could potentially have some risk. I think the vaccines generally are very safe, and especially those that are recommended are safer than not getting it. But I'm hoping that will give me some added protection for respiratory viruses, at least when I'm traveling. Yeah, if I can get it covered. There are some other categories of vaccines we get less frequently, pneumococcus and pertussis, which is whooping cough. So the most, let's do, I guess, pertussis first. It's the whooping cough one. It's a part of, for adults, children get it normally, the whooping cough one when they're young, but for adults, it's a part of the tetanus, diphtheria, and what's called acellular pertussis vaccine. And so that's usually about every 10 years, but it's a very good vaccine. It does help protect adults from whooping cough, which could go on for 6 weeks or more of illness if you do get whooping cough as an adult. So be sure to be up to date on the tetanus and pertussis vaccine. And then the other one is the pneumococcus. They have some newer pneumococcal vaccines. They're called conjugated vaccines that have 21 different pneumococcal types and most likely to cause disease. All of us have pneumococcus in our nose at some point every year. And on average, at any given moment, one of 4 people has pneumococcus in their nose. We just can't predict which ones are going to get sick, such as, an ear infection, sinus infection, meningitis, sepsis, or pneumonia, but particularly get very, very sick from it. And I don't know exactly, there's probably more than 100 different serotypes of pneumococcus, probably a lot more. But in this conjugated vaccine they give now, it's a 21 valent one, I think. And that's probably one of the better vaccines that gives you good protection against, severe invasive disease. That's always another thing you hear in the media all the time in the news is, oh, it's not 100% effective, or it's only 17% effective. Well, it depends on what they're saying, what they mean. Do you mean they're not going to get any disease at all, or what? Even though it may only be 40% protective from getting influenza, for example, it still gives you a greater benefit of dying. You have a much less chance of dying from the vaccine, even though you still got the flu. So people bring that up all the time. Oh, when I got the measles vaccine, that prevented me from getting measles, but here I still got the flu after the shot and all. But it does give protection from protects you from dying and being very sick.
So you're going on international travel. So I do the same thing. How do you protect yourself through the plane and airports and all of that? Do you wear masks, or you just come and wash hands? What are common things that you do for this airports and traveling, as the world getting so small and we travel all the time?
During COVID and early COVID, we'd be extremely careful with, N95 mask, minimal contact. But in general, what I do is I don't always bring hand sanitizer anymore on trips, but on airplanes, I generally would. And I clean my hands as soon as I sit down on an airplane, just because if I touch something coming in there, I don't want to touch my face. So that's one thing I do, is I do keep my hands clean on a plane. They keep on changing the rules of how far to sit from someone who's coughing or has it. There's three main things that can spread very far, no matter anywhere on the airplane. It's chicken pox, but most of us are immune either from natural disease or vaccine. Tuberculosis can spread very far, and measles is a big one. So the reason is that they can stay on very small particles, like dust particles almost, that can stay suspended in the air and spread very, very far. So those are the ones that are a little more dangerous, but most of us are protected because of vaccines for measles and chicken pox, and less likely to get tuberculosis, but it's possible. Early on, when we did these studies, I used to do pediatric infectious disease. I remember they used to do research of how far can these viruses spread by studying people that were in prison, but they realized that's unethical to study prisoners. So now they let medical students do the studies because they get extra credit, and they're fine, doing the studies. And they would put the medical students a certain number of feet from a crib of a kid with influenza, parainfluenza, like or one of the other respiratory viruses. And if the medical student was more than about 3 or 4 feet from the crib, they wouldn't get it. So they thought these droplets fall out of the air and they just don't go that far. Well, later, they actually did find out on airplanes when they did epidemiologic studies of who got the flu, who got these. I don't actually know which ones they studied, how far away they were. I think they extended it to 6 and then 10 feet away approximately, I think, just to give you a rough idea. And then during COVID, it all changed. They realized, maybe this is going even further and other people are getting it. It was so hard. So there are these specialists that know about how things are spread indoors in different environments based on the humidity of that room and, so many other factors. And I don't know, and I'm not an expert on that, but the general principle is the closer you are, more likely you are to get it, especially if you touch your face. So if someone's hacking up a lung in there within 10 feet of me or more, I might consider putting a mask on. I don't always think of it that much, actually. At the beginning of a trip, when I don't want to get sick, I'm a little more careful. I have 4 kids, so it's like filtering the whole environment. And so if someone gets it, the rest of us will get it on the rest of the trip because we're all in close proximity. But I think that's one of the main things they do. So, that, and unfortunately, when we travel, you'll often miss out on sleep. So because you don't sleep well, you're more likely to get sick. So I try to sleep, especially the first day or days after I get somewhere, if it's a different time zone. It's very hard for me to sleep before a trip. I get too excited about the trip and just pack a few minutes before leaving. So I'm usually behind. But yeah, clean hands, careful on the plane, vaccinations beforehand. I usually don't bring a lot of medicine. I used to, but I think I'm going on some more wilderness type trips coming up now, and I am going to take some medicine. I generally don't use antibiotics almost ever, but I might have some antihistamines if I get itchy, and maybe some nasal stuff if I get a cold or spray, but I don't do a whole lot. Do you do anything in particular, you guys, when you travel?
I have a whole regiment of things because we travel a lot. And mostly for GI than other respiratories. So besides, wash your hand, try to eat cooked food and try to eat healthy food, stay healthy. My regime is just, I will always take some medicine with me. I take some anti-diarrheal, some, metronidazole, some Cipro, or maybe, azithromycin. But I also believe in Pepto-Bismol. If I eat somewhere that outside, take a Pepto-Bismol in the morning, and if there's too much street food, I take a second one. That's sort of maybe whether it's voodoo or whether things helps me to there. And I usually don't drink bottled water in the United States. I don't like that. If I'm traveling and I do not know what it is, then I try to stay a good sanitized water to stay hydration. So cooked meals, I think, at least for GI tract, for other infection, I'm not the expert, but the thing is, the open lettuce or open salad, stuff like that. And I try to avoid those and just stick with the fruit that has coverage, like banana, oranges, stuff like that. So those are, because we travel a lot, and I do take some medicine, some, antihistamine, some decongestion, and sometimes, just rehydration stuff that in case I get sick, have some rehydration quick therapy. So those are what I do.
When I was traveling internationally, I haven't done so in a while to to rural areas, but I would also do the bismuth Pepto-Bismol trick that Abbas just mentioned, just taking that after eating some food. But also, I found that beer actually is among the safer of the things to drink. The water you're not so sure about, so beer tends to be in a bottle, sealed at the factory. Well, at least presuming it's sealed at the factory. That was seems a little bit safer in China than some of the other beverages that you're not quite sure where the water is coming from.
And you just killed some of the bugs too.
There you go. Maybe so.
Yes.
Tom, I just had a question for you about vaccinations and sleep. I think there was a paper showed that some individuals, if they were not slept before the flu shot, they might not respond as well. Do you give any credence to that? Do you recommend people try to make sure they're slept before they get the vaccines?
I don't know that I heard that one, but it makes a lot of sense. I think your immune system would wane when you're not sleeping well, even maybe just one night. So that's a real good point. That's a great idea. I think being in your best shape, you have the most exuberant, robust immune response to the vaccine, and that's what you want. So I remember, they've done many studies where some people would take something to lower your temperature or pain after a shot, ibuprofen or Tylenol, and that might also dampen the natural response to the vaccine to some degree. Most of the time they say then, well, it may not matter that much because it makes them more comfortable and they sleep better. But so I don't think there's one size fits all, but those are things to keep in mind.
So if you got sick, for example, you're traveling or you got, say, influenza, there's 1,000 grandma's remedy and everybody has their own potion. So what do you recommend in generally we do? What do we do? ABC, just to, now you're sick, how to just minimize the chronicity and the complication of any viral illness?
For me, I know if I feel something coming on, I just try to go to bed early and try to sleep more. And usually that alone is one of the best things for me that works. So sleep and even a little more sleep, drink plenty of fluids. I don't do a heck of I don't do much magic. I think there had been, some things with colds where people would take zinc, right after exposure. And I think I've done that a few times. I don't know how well it works, but sometimes they say that helps. A zinc supplement, or I forget what the different forms are that they sell over the counter, Zicam or whatever they're called. I don't remember. I think if you get very congested right away, that might disrupt your, maybe that's a good thing to flush things out. But if it's so congested, you get stopped up easily. And sinus pain, it might be good to use 3 to 5 days of a decongestant spray like Afrin or oxymetazoline to shrink the membrane so you can breathe better, or even a decongestant pill, or like a NyQuil nighttime to help with most of the symptoms so you sleep a little better. But again, when you mess with Mother Nature too much, you got to decide, is it worth it or is it really going to help you? And I think normally I hadn't done that, but for some people, I think it does help them to take those
What
things.
about chicken soup and echinacea and those type of things?
I don't know a lot. I think in some places they've studied, you probably know more about it than I do. I think in Germany, they study a lot more about some of the herbal remedies. As long as, I think certain ones like St. John's wort, I think might be an issue. And Some of them might have interactions with some of their other medicines, but I don't know. I think in the United States, because of the way they market a lot of these things, I think it might. I don't think we have enough good data when they sell stuff that I'm not sure it's all so legit, but it maybe so. What have you tried, or what do you think?
Well, I am come from an Asian town. We have cold and many medication. It's one of many herbal medicine called is four plants cold medicine. So I was been using this in childhood. Anytime I go home, I bring a whole bag of it, 2-3 bags, and anywhere we have. So we brew the tea in the evening, just even with some honey and stuff like that, soothing and trying to eat some soup. So I use the not American, because in here the pills and stuff like that, I don't trust them. But I go to our own, herbal doctors when I go there and just get that definitely with cold. My kids, they believe in that very much. So we brew some tea that's been around, for centuries. And my parents, my grandparents, I use it too. I trust those more than modern medicine. So I use that and the soups and other thing too, just for hydration and good nutrition and rest. And so I do those things. I do use the herbal medicine.
I don't disagree at all with that. I think a lot of Americans will poo it, and they kind of arrogantly say, "Oh no, there's no data." Well, I don't know. It seems pretty good when your grandma's done this and everyone else has done it, and they seem to do well. But yeah, there's different remedies in all sorts of places, as long as you're not hurting someone with what you're doing. And I've seen that too, where people are kind of pushing it or selling it, and some of the homeopathic things that could potentially hurt someone or just cost a lot of money. But man, yeah, I remember just doing my basic science research for infectious disease. We brought up that same exact concept. For millennia, they would use these different things, garlic, and I just forgot all the others. And yeah, it would be nice to get more studies with how we use it, and not just take it down to a pill. Because there's probably some entourage effect of taking a whole natural food of the garlic and the way they put it together, but not just a pill. Even though it sounds kind of good, probably not the same as the whole food or whatever it might be.
And the thing with the teas is the hydration by itself, and usually they're smooth for your throat with little honey, stuff like that. When I was in China, in a hospital, they had traditional medicine and they had modern medicine. And the traditional medicine, was the biggest dilemma. They says, we know that has worked for a century, but it's tough to do study, or tough because it's a mixture of things and may work for some. And I've been to a herbalist, for example. They says what's good in springtime is maybe beneficial, maybe not good in there. So it's a lot of tradition, a lot of teaching there, which is very tough to explain in modern medicine. In modern medicine, we have X, Y, follow this and that and see the result. But not everything's black and white. Sometimes you have to follow the common sense, and the good thing as our immune system is good enough, so we get over this disease regardless. Our body will take care of it. You just need to be patient for it and just not expose anybody and just get enough nutrition to your body and rest. That I think a lot of the complication happens when people ignore that and just go out and do other things or drink alcohol and smoke cigarettes, and then that's, I think, a lot of complication and chronicity takes place.
I agree. I think we could learn so much from so many other countries of how they take care of people in a much more practical manner, not do as much waste as we do here. And a lot of ours is marketing and drug companies and whatever it might be. But when I worked in Tanzania for about 4.5 months in rural Tanzania, and when people got sick, they didn't go to a white man doctor with a white coat. They would go to a witch doctor, and the witch doctor would put on this leopard skin hat where I was, and he would do this chanting. He had sort of a stick with a wand and a thing on it, and he would do this chanting. And then what they did with the village where I was, he would take a razor blade and cut slits to let out the evil humors, like the Middle Ages, where the barbers would draw blood and let out the evil humors. And sometimes those patients got better. And sometimes if they didn't get better, they would come to the white doctor, who would put on a white coat and wave this wand of a stethoscope on their chest, and I'd be chanting all the reasons and logic for what I'm doing. And then I would jab them with needles, putting in our evil humors of medicine, and sometimes they would get better too. So, I don't know if one is always better than the other. It just depends on how we think about it and the context that you're in. But I think there's many different ways of doing it. And the more natural, the better, I think. Sometimes medicines do help and they're life-saving and are very important.
What do you think vitamin C? Everybody's, as soon as they get sick, they just go crazy over the vitamin C. All these tablets or other drinks. What are your thoughts on that?
I've gone down that path too at various times. I remember when they talked about the antioxidant effects of vitamin C and beta carotene and what else, and whatever else they brought up at the time. And then, when they do data and they study it over and over again, they don't find much benefit for most people. Again, it doesn't mean it applies to every single person, but in that study population, they didn't see much difference. So I know Rob had done his training at Mayo, and a lot of my classmates were at Mayo. I like looking at Mayo clinical proceedings and just the Mayo Clinic's recommendations on those sorts of things. So, when I look it up and see how they present the data, it doesn't mean I have to swallow it all, of what they're saying, but I want to hear their perspective, and I often trust their perspective. I say something also to my kids when they come back home, they say they don't like the teacher, so I'm worried, okay, if they don't like that teacher, they're never going to learn anything from that teacher. Well, they probably can learn something from that teacher, even learn about the things you don't like about them. But it's kind of that concept of don't throw the baby out with the bathwater. You don't have to believe everything they say, but, there's probably something good in there. And, just hear them out, hear the voice. There's a big one in infectious disease like that. I think it's so important that everybody speaks their mind and we support that. In infectious disease, I don't remember when, more than 100 years ago, I think, Ignaz Semmelweis in Vienna he was a physician that noticed that all these mothers on one maternity ward were dying after they delivered babies, and found out that the ones that were dying were the ones that the medical students were taking care of that had just finished the anatomy lab, came over without washing their hands and delivered the babies. Whereas the nurse midwives who were on a different maternity ward, they didn't have an anatomy lab, and those mothers were not dying. So Semmelweis was convinced it was because these medical students weren't washing their hands. They washed their hands and they got better. But he was a minority voice, and everyone thought he was ridiculous. That's crazy. They took his medical license away. He actually ended up in an insane asylum, but he might have had some crazy to him also. But even if he were crazy, he still had the right answer, and it was a minority voice that was the right explanation. So it's good to hear all these views.
You said something earlier, Tom. I wanted to just ask you a little bit about. You said I rarely take antibiotics. Could you kind of just expand on that a little bit, and why? Why are you trying to not take antibiotics? I think that's something that our listeners could learn from.
So do your listeners know your specialties?
Yes.
Oh, so hematology, oncology, gastroenterology, but the most important organ system, right, guys? Just name it all together. What's the most important organ system in your body?
GI.
What?
I was going to say the immune system.
Well, GI is the majority of the immune system is in the gut.
To me,
your gut is
the
not
most
happy.
most important organ system in your whole body is your microbiome. And
well, where are they? In the gut.
A lot of it's there, not all of it, but the microbiome includes all of the bacteria, viruses. We have trillions, 100 trillion bacterial cells, viruses, fungi, parasites that are a normal part of our body. That's far more than the number of regular, what you call human cells. So they are really human. They're all very critical, important part of us. So we had the Human Genome Project, which tells us some basic outline of what our genetics are and potential might be and what might happen. But, I forget the words they use, how much of that actually is reflected in either disease or personality traits or whatever it might be. It's when they do identical twin studies, it may be 10% for some things, 50% for some things, but it doesn't change. Your genetics are your genetics. You might have other things that flip on and flip off certain genes or certain epigenetic phenomena that might change a little faster. But your microbiome has so much genetics and DNA and RNA that's changing by the moment in such a complex, interactive manner so quickly. It affects every aspect of our lives. It affects, heart disease, strokes, personality, psychiatric problems, obesity, everything. And since everything is connected and interacts, the things that affect our microbiome, our sleep has a big factor, our diet, our exercise, anything we put in our mouth. And when you put things in your mouth, like antibiotics, it's like a bomb. It's one of the worst things you can do, even though antibiotics are generally safer for other parts, as far as fewer side effects than chemotherapy or some of the other immunosuppressant drugs. They have a profound effect, much of which we don't even understand. I don't know the exact date, and it might be even hard to show, but I've heard reports where if a child had an antibiotic within the first 6 months of life, they're much more likely to have obesity. There's psychiatric problems associated, with antibiotics. It's kind of hard, and I don't know how they do the studies, but I'm sure they have an enormous impact, and it's so complex of how all these organisms interact. Like the microbiome on one side of your teeth might be different than the other side of your teeth. Your microbiome is very different at different levels of your gut, and your microbiome changes as we age. Babies have certain things in their microbiome that's geared towards babies, such that breast milk, a large part of the nutrients of breast milk don't even go directly into the baby. They feed your microbiome to help protect you from infectious diseases. So that's why I think natural breast milk would be very important for them if possible. But to me, using an antibiotic, we sling them around way too much, and they're already in some of our food products, and to keep the animals to produce more meat and not get sick or whatever it might be. And we probably have incidental exposure to antibiotics all over. So I just really don't think we should be throwing antibiotics around as much as we do. I think it causes a lot of harm to our bodies. We just don't understand.
Is there a good way to restore the microbiome? If say, for example, someone, someone has to take an antibiotic for, say, pneumonia or, a cellulitis or a skin infection, is there a good way to restore the microbiome more quickly?
You don't ever get rid of all the bacteria that are in your microbiome that I know of. I don't think so. You just shift the balance of them. And I think even a single dose of an antibiotic might selectively not only, or it could lead to new type or new bacteria that are more resistant, and that could be permanent then. So you can permanently affect your microbiome, but normally when you stop the antibiotic within a few weeks, you get back to your natural microbiome. Most people, their microbiome, that comes from their mom, usually in the first few weeks of life, and it changes throughout your life to some degree. But I think all the same things you guys always talk about, wellness, whatever you can do to be well, sleep, nutrition, well-rounded diet, not highly processed foods, try to have natural foods and a variety of different foods, and fiber is probably more important than anything. So, the concept of a probiotic sounds like a logical thing, but it's not that clear. I used to go to our international meetings, and I participated in some of the studies on the human microbiome project or whatever it was. I don't know how good the studies really are, but I would monitor what my predominant organisms were in feces on different diets. And yeah, I don't know what it means, and I don't think anyone really knows what it means when I do that. But I think taking a probiotic can be good for one person. It could be bad for someone else. So even like a boss, I'm sure, has had to deal with, C. difficile colitis. It sounded good to do fecal transplants, but not always. There are other side effects that we might not have thought about. But when I went to the meetings, I became a little more concerned about automatically putting people on probiotic. I think it's more important to do the prebiotic ideas of how can you nurture your normal microbiome by sleep, healthy food, well-rounded diets, fiber, etc.
Yeah, we had podcast on probiotic many years ago. I thought that was a great idea. The more I studied, the the microbes and our gut micro there is very different from Alaskan to Tanzania to Western to wherever you live. So it's so different. So picking a few little chews and give that to that, I don't think it solves the problem. If you eat an apple, I think it has more prebiotics than taking those tablets. And so many of my patients, they take it. It's $52 billion industry, and they've done many studies. They feel like really, even with C. diff, maybe a week or so, maybe even that doesn't, because it sometimes grows certain bacteria, then defeat what naturally we have to protect. It kills those too as well. It's just, it's like you have a garden got burned out. Instead of let it recede or just let naturally take over, you just put maybe some grass there, just it grows, then prevent from the natural process of things happening. So I was maybe probably at the beginning, but the more I study, the more I think is, as you said, a good salad, a good nutrition, a good hydration, and avoiding this processed food, like especially diet sodas and stuff like that. So I'm definitely with you in this probiotics. They're way used too much, and given it's like placebo, and people feel great on them maybe for a week, but I don't think so. That's the solution to our macro. In our guts and our health.
It's just so hard to know. There's not going to be one study that fits all, So if people tell me they've done it and they really feel good, then I say, well, good, stay with it. But I don't want to routinely just say everyone should take it because it's so hard. You're not going to know. Did you guys talk? I don't know how dealing with your microbiome again. Did you talk about the study with mice and the variety? They had sterile mice. That were born, so they had no bacteria in them, and they had them in separate groups. And then they had, I think they actually had identical twin humans. One was obese though, and one was thin. And the one that was thin had a great variety of different bacteria in the microbiome, and the obese one had far fewer bacteria. And so less variety. And one of the theories was, well, they're probably having too much of certain food or processed food, and they're nurturing. It's kind of like the overgrown pond with too much fertilizer, where something overgrows and it kills all the rest of the variety at that pond or the forest. I don't know if it's exactly, it's not exactly the same, but that sort of idea that it was much healthier to have a very diverse microbiome nurtured by fiber and all those diets and such. So when they gave the feces from the thin woman to the mice were thin. When they gave the feces of the fat one with the fewer microbiomes to the other mice, they became obese. And then when they put them together in the same cage, they would eat the other's feces, and they would all, get fat, or I forget how, I think they all got fat actually. But, so it makes a big difference, trying to nurture the most important organ system in your body through one of the third or fourth most important GI tract. No, whatever number you are, GI tract is fascinating. And the immune system kind of too. But no, it's all very important. They're all interconnected, but it's so fascinating. I don't know how in the future they can study it, because it changes throughout life. It changes different parts of the world. It's very different for those, the way they're eating in those other countries. But I would think this was one area where you really got to involve people from many different specialties and disciplines, not just medicine, but, physicists, quantum physicists that know how to put this together. Some people who can more logistically, how do we design such studies to see how all these things are interacting? And once they can finally try to decide how to enter that, they might come up with something useful. It's just going to be a lot of work to figure that out, I think.
Well, I think a good example is nursing home. My mother-in-law is an assisted living. When you go there, all their food is pre-packaged, pre-processed, so they don't get infected. And because they do not use anything natural, and if you go to their cafeteria, everything's just open can, warmed up, or open bag, warm up. And I think that's why we see so much C. diff, so much infection in nursing home, because their gut microbial is none. If we don't have fruit for them, there's no fresh fruit in there. Even if sell fruit is from a can or from a jar. So I think it's a good example to see that, and I see some of my own patients, they were living pretty good at home, they go to these places and suddenly become dysfunctional. They get sick and they go down. So I think the more diverse we are, the more natural food we eat, the less processed food. And I think and it's different. And I forgot, one of the university did study stool from Tanzania, study from United States and a couple other cultures. And I find out that the amount of bacteria in the guts of people from Africa was completely different and a lot more than if somebody lives in big cities in America. So those all, I think, through the ages that affect us. And I think when you look at longevity studies that we look at, you see a lot of these blue zones. They're more natural, more rested, more thing they do. And they don't go to doctors. They don't go to gym, and they live long lives. So you have to say a lot to that as well.
They smoke a lot too.
The
Italians, the Sardinians are all smoking.
Yeah, and they drink wine and stuff like that. But I think it has a lot to do with the natural environment and more complex than I think we can do at this session.
Whenever I ask the travelers that are native to other countries, especially in developing areas like in Africa and Southeast Asia or others, they love going back there because all the food tastes so much better. The fruits, the vegetables, even the chicken they bring up all the time. I think ours becomes so highly processed, and the way it's cleaned and over cleaned and picked at the wrong time, it just doesn't have the taste. So it's kind of fun talking with them. They say, I had one guy tell me, if the food doesn't have flies on it at the market, they don't want it because something's wrong with it. They want the ones that have the flies on them.
Yeah, so it's a different stroke for different folks. So any more wise comment for this season for us? And audience, any pearls that we didn't cover?
I think it's always good to listen to all the different options. If in doubt, just decide what kind of recommendations you trust and from who. Like I mentioned, I do think the vaccine recommendations from CDC are generally very good. They can change their mind. There's mistakes that happen, but I think vaccine recommendations are generally good to follow. Again, one size doesn't always fit all. So if you have a real good reason to do otherwise, discuss it with someone. Don't keep it a secret. It's, tell them your thoughts, speak your voice. I think often when we decide we don't want to have that conversation, we are the ones that are not being open. We say, oh, no, they're wrong. I know the right idea, so I'm not going to tell anybody. Well, I don't know. That's better, actually, I think, if you test your idea off a few people, because they might have thought what you thought already, and it might be right, might be wrong. But try to be open to hear the other ideas. I think, again, to me, the natural things of lots of sleep, using your muscles, eventually kind of get in tune of your body. I know one for me, some people get so regimented. Oh, I have to work out on Monday, Wednesday, Friday at 5 a.m. and myself included. I would do stuff like that over and over. And then I started realizing, well, sometimes I don't get enough sleep on those days then. And it's probably better to prioritize sleep and not get to the gym right away and do something else just outdoors, or listen to your body. If you're overdoing it, you don't have to go every Monday, Wednesday, Friday. It's good to do something throughout the day, but try to be open to adapt to how your body's feeling and changing, I think, all the time. And I think your immune system will work better, will protect us from infectious disease better. So to me, I think that's very important. I think people get too rigid sometimes on how they do their lives, and it sometimes hurts them.
Say you get sick and you get flu or whatever it is, when is a good time to seek help? Go to ER or go see a primary care doctor? Because majority of these things we overcome, but there's a fine point that we should not just sit on it. And then what are some of those signs or symptoms?
The main ones probably are whenever you're struggling to breathe, that could be an emergency. So if you're really struggling to breathe, you have to get to the emergency room immediately, and probably call someone to help you in case you get so sick so fast. So struggling to breathe is an emergency. People who are confused, they don't know they're confused. So if you think something's very funny about the way you're thinking, or you might be starting to get confused, as soon as you can show or tell somebody right away, that's a big one. But then main other one is if you're not making urine several times a day, you're probably getting dehydrated or you're not flushing your kidneys, you're probably sick and you're leaking fluids out. So those three to me are probably the most important. A fever itself, if you're immune compromised or sick from something else, a fever could be very important. Otherwise, a fever can be good for you. If you already have heart disease, you're on chemotherapy, immunosuppressed fever, you should probably call your doctor or provider right away. But other than that, a fever is probably good for you. It's a good thing to have. If it disrupts your sleep, then you can try to suppress the fever. But to me, those are the most important things. And then anything changing very fast. Some bacteria, the two main ways bacteria probably cause illness would be acute or chronic. Chronic being a much slower process. It's harder to tell, but if you're progressively worsening, you definitely should see someone. If you're acutely ill, often it's because one mechanism is called quorum sensing, where the bacteria will reach a certain high concentration, like a quorum on a committee, enough people to vote. And once it reaches that high concentration, they release a toxin and you get sick very fast. So you might get a teeth chattering chill, shaking like a leaf. They call a rigor. So if someone gets that, that could be a good reason to go to the doctor right away, because it's hard to know what direction it's going. You could just get better, or you could get very sick and septic, which is where you're not pumping blood to your organs very well, and you get sick very, very fast.
I learned a ton. I wanted to really thank you so much, Tom, for doing this,
Oh,
and
sure, my pleasure, man.
really enjoyed this, and you were just so brilliant. I think it's gonna just our listeners will love this, and we'd love to have you on again. I'm sure there's lots of, I know you're just such a diverse, vast knowledge that you have. I think that would just be amazing to share with our listeners.
It's nice of you to say. It's great to see you. It's great for all your work you do. Thanks for doing all this for everybody. Good job.
Well, have a wonderful trip, and we'll talk to you after your trips. We look forward to hear from it.
Thanks. Good to see you guys. Bye-bye.
Right, take care.